Team KLEMAT is to have Palau be ready, be prepared in terms of disaster. We're surrounded by so many natural disasters such as typhoons, rising sea level, climate change. And so we want to have our community ready and be safe.
So yesterday we had a hike down through the forest to the other side of the island, simulating a person that had gone in the woods. I got hurt that we had to go and retrieve.
And then we had to treat the patient with injuries. So we didn't have a real patient, so we put all our champagne we carried on the stretcher, and 4 of us carried it. So we had to come up ways of transferring the patient over the trees or under the trees. So it's kind of hard. But we communicated back with the EOC via radio. So with the teamwork, we were able to carry the patient back.
Wow, yeah, the radio communication, that's the most interesting part of our training.
We are stabilizing the patient.
So the radio communication exercises were essential because during a disaster, you're going to have to use radios to communicate with different areas within the camp setup. It's the most efficient way to do it, instead of deploying runners who takes a person away from their particular triage area.
Our scenario from yesterday was a boating accident, so we expect trauma cases. We want to be able to set up our camp very quickly. We started out by setting up our triage area, and then we worked our way through all the medical tents for all the different categories like green, red, and yellow.
I was the triage nurse, so I was in the triage tent. We received the patient, we labeled them according to the colors and their conditions, and then we put them back to the tent.
If there were a major injury, they went to the red area. If they were a major injury but not so urgent, they went to yellow. And if they were walking wounded, they went to green.
In an event like this, the red tent is what we want to be ready the most. So we're going to be dealing with a lot of very severe patients.
I saw all of the different stations that they would have if they needed to set up for a disaster. They had people actually acting out that they were injured, and so they would have to quickly assess and then take them to the right area for proper care.
Members of WHO were able to play the part pretty well, really play with your emotions and really kind of stress you out, which is something you can expect. So when it comes to a real incident, you're prepared. You're mentally and physically prepared to handle all that stress.
It was impressive. It was really impressive to see them in action. It took them 40 minutes to set up the whole triage center and be ready to take patients, which is pretty quick response time. They're completely self-contained, they have their own water, and they have all their own supplies and equipment.
So we're often asked what KLEMAT means, what the acronym is, because the other emergency medical teams in the Pacific, such as KLEMAT, is Kiribati Medical Assistance Team, but KLEMAT's actually not an acronym.
In the past, we used to sail between the islands, and one of the most important components of a sail was KLEMAT, which is actually the part of the sail that steered the boat. And so we thought it made more sense to use the word KLEMAT because the meaning of it is also implied in the work that we do, which guide us in the way that we treat people in natural disasters and disease outbreaks.
If we didn't have those donors, KLEMAT wouldn't exist. So, I would really like to thank the main donors, which is the government of Japan or the people of Japan and the USAID, because without their support, Palau would find it very difficult to establish and maintain the team at this certain point in time.
On behalf of the ministry, we thank our partners, USAID, the government of Japan, as well as the World Health Organization, WHO, for their support in establishing the team and their ongoing support with operations. And I think Team KLEMAT and the concept of having a national emergency medical team is one that Palau should invest in as a national asset.